Usually following your effleurage, you're going to then move to doing friction. So friction has several different components to it, but again, what is its purpose? Its purpose is to really separate the muscle fibers apart, and by so doing that, we're going to break down adhesions that are occurring in the muscle. We'll help to break down scar tissue. We help to better align the formation of the healing tissues as a result of breaking down what are referred to as cross bridges. Because muscle fibers run in a particular direction when we're born and initially develop, but when we become injured, what happens is specialized cells go in there to try and repair the area. And when they do that, they send out these branches to grab onto anything that they can to pull the fiber back together and try to create the healing. Just like when you get a stitch after a surgery, it's pulling the two sides of the skin together to get it close enough to heal. Well, these cells are doing the same thing. They're trying to grab on, and then they're going to shrink down or pull down and pull the areas together, and that's what's going to help to get the edges closer together to heal. Now, in a perfect world, those reaching out would all be in the alignment of exactly where we want them to go. But the fact of the matter is, they don't. What they do is they reach out and grab onto anything they can around them and anchor in to pull it closer together. So those ones that are not in the direction that we would really like them to be, we give them a name and we call them cross bridges. Now, cross bridges are not very strong, but they have the ability, because of the number of them, to really restrict the movement of fiber. So what we want to do as the tissue is healing is we want to try and break off those cross bridges so that they're not grabbing on at the sides on the angle, but leaving the ones in place in the direction that we want to do. Right? So that's a big thing about friction, is what it's really trying to do in a nutshell, is get that alignment going in the way that we want. Now, the other thing that we use friction for is, again, that mechanostimulation, right? Or the stimulation of the mechanoreceptors, primarily the Golgi tendon organs. And the Golgi tendon organs are located at the musculotendinous junction of a muscle fiber. So a musculotendinous junction of a muscle fiber is where the sarcomeres end and just the fascia continues that wraps every muscle fiber. That's called the musculotendinous junction. That's where we're going to find GTOs. So GTOs, depending on the type of muscle it is, let's take, for example, a muscle like the trapezius muscle. It has fibers that are running way down, covering a big, large area, right? And they're kind of pan type of a fiber because it has a smaller insertion point on the scapula, but it covers a big, broad area. So it's kind of like this big wave of fibers, and then they all kind of narrow down to kind of cover into an area. So on those, you're going to find the GTOs are kind of more on an angle over maybe along the spinal cord, and then they'll also be found along the insertion site, right? So another type of muscle fiber you have, which is very, very common in the human body, is called a fusiform muscle fiber. And that's where the muscle fibers are all simply in alignment with one another, and they go from the attachment at one end of the fiber to the attachment of the bone at another end, at the other end of the fiber, and we're going to find the GTOs located, in fact, at those two ends. So, and those are very often the origin and insertion sites of a muscle, right? So again, depending upon the type of muscle it is going to depend on where you're going to find the GTOs. So we can do friction with multiple different parts of our body, right? We can do it with our thumb. We can do it with our finger pads, right? Finger pad, remember, is different than a fingertip. Fingertips do not have any proprioceptors in them. That's why you can jam into things and it doesn't hurt very much, or you don't feel it very much, right? Whereas the pad, the fleshy part underneath, that's where you're going to find the proprioceptors that have the ability to pick up minute little changes in the tissue. Like I was saying there, you can use the pads of your fingers, you can use the pad of your thumb, right? We can use the interphalangeal joint, which is the bone between each of your fingers. You have three bones called phalanges or phalanx, and the one in the middle is called the interphalanx. And we can use that when you bend your knuckles, kind of like that. You can see it makes it flat. You can use that as a frictioning tool, right? You could use what's called the pisiform or heel of the hand contact point. So that's, you know, you kind of using the very back of the heel of your hand there, and you can use it to friction as well. Okay. So how do you determine which tool to use? Well, how you determine that is quite simply about, well, what is it that you're targeting? If you're targeting a big area, like let's say your erector spinae, well, you could use the open palm of your hand, and you can use the heel of the hand to do the friction. Whereas if maybe I wanted to be a little bit more specific, and instead of targeting the entire erector spinae group of muscles, what I want to do is I just want to target the longissimus muscle. Well, for that one, I might change and use my knuckle contact, or my interphalangeal contact, right? It's a little bit smaller. It's still fairly firm, gets the result done. And if I want to do something much more detailed, or if I'm really wanting to focus on what I'm feeling underneath my contact, well, then what I want to do is I want to make sure and use the pads of my fingers, because in the pads of your fingers, you have more proprioceptors than anywhere else in your body. And actually, your middle finger actually has the most proprioceptors per square centimeter of any contact point in your body. So we really use that a lot for palpations. Very, very sensitive. It picks up minute changes. Now, irregardless of what type of massage technique you're doing, whether you're doing effleurage, or you're doing petrissage, or you're doing friction, like we're talking about now, what you always want to do is you want to have the other hand open with the palm in contact with the client whenever you can. And the reason for that is because although your finger or your hand might be doing the friction in one area, your brain is picking up changes that are occurring in every nerve contact point in your body. And that information is coming up to your brain. So your brain is analyzing all that process. And by so doing, it helps to determine, is the muscle reducing its contraction or not? That's happening without you even being aware of it as the therapist, right? Your brain kind of knows what you want to do, and it's kind of saying, okay, if this is happening the way I want, these sensations will change this way, right? So we always try to keep the other hand open when we're doing the techniques. And in fact, when we're doing not every technique, but almost every technique, we always keep the hand open to assure that as much information is coming into us as possible. So now there's a little bit of an overview of the friction thing. So let's talk a little bit now about more specific. So what are some of the things about friction we want to make sure? Well, the first thing is, if you notice my hand here, you'll see my hand has a slight curvature in it, kind of like a C shape. If we look at it from the side, it's kind of a C shape there. Now, what is the purpose of that? Well, watch what happens. If I move my thumb closer to my fingers, do you see how my wrist straightens out? If I move my thumb farther away, do you see how my wrist starts to bend? So you can use your thumb in contact to help to keep your wrist in neutral, because we want the wrist to stay in neutral, because we don't want to get flexion and extension occurring when we're doing the technique, because that will lead to carpal tunnel syndrome, which will prevent you from being a therapist, right? So you want to always keep that wrist in that neutral position, like that. We want to keep the C in the shape of the hand whenever possible. You know, it's not going to happen overnight. You're going to take a lot of practice to do it, you know? So don't get frustrated when you don't get the result right away, but it'll come. But try and think about keeping that friction in that position. And then we're going to do circular motion. So the contact, whatever we're using for contact, we're going to do a circular motion. Some books say towards the bone, some books say away from the bone. That's just people's interpretation. It doesn't matter. You're doing a circle, well, when you do a circle to the right, that means you're going towards the bone on the left and away from the bone on the right, or whatever it is. It doesn't make any difference. Fraction of the fact is are you doing a circle, and that's all, right? That's important. So you just simply, we're gonna I'm using this example, I'm using my finger pads, right? Now, some people's hands are even different. You know, some people have a really short index finger. Some people have a really short fifth digit. So on me, you can see that my fifth digit is very short in comparison to my other fingers. So as a result of that, I'm not going to use my little finger to do friction. There are other therapists out there that have fingers that look like they're all exactly the same length, and they can use all four. More power to them. You know, that's why massage is an art. It's different, right? And that's okay. So you're going to do that. So then what we're going to do now, that's frictioning, C-shaped frictioning, I guess. I think that's what we might call it. All right. Now I'm going to do the same thing. I'm going to do a circular motion, but now I'm using that interphalangeal articulation between the two phalange bones of my finger. Right? So I'm doing a little bit. I can sometimes now when I do that, what happens is the middle and second digit lock up with the metacarpal bones, which lock up with the carpal bones in my wrist, which lock up with my radius. So it's like it becomes a straight board, almost like a solid bone, because the joints are all what's called locking. So as I'm doing that, you'll notice that I'm not moving my arm at all. What I'm doing is I'm actually moving my hip in a circle, thinking about my hip going in a circle, and I'm transmitting that movement up through my body and along that arm, right? But you'll notice I'm not really doing anything with my fingers. They're just kind of along for the ride, the end tool, right? And, you know, a good example of how that kind of works, that locking, is if you ever take martial arts. You know, they always talk about how to do the certain kind of strikes. And the reason for that is because when you do the certain motion, it locks all the joints. It allows the body, the pressure of your body, to be transmitted through in the force. And that's how it all works. Right? So what we talked about the interphalangeal friction. We talked about finger pad friction. If I was using my thumb, I could do that, right? You want to kind of disperse which tool you use for doing friction, because you don't want to wear your hands out. So you want to keep, you know, moving around. Use some thumb work, you know, and some finger pad work and some interphalangeal work, or some pisiform, heel of the hand contact as well. And if you get really good at it, and you're really good sensation, you can even flip over and do a technique called an elbow friction. So in this example, I'm going to put my elbow down close to it. I got to be careful of the bony prominences now. I'm going to do that, and I'm just simply going to do a circular friction with my elbow. I must be doing this work in Winnipeg because my skin feels a little bit dry myself, so I'm grabbing on them. So I might want to take a little shot of lotion on my own elbow. I don't want it to grab too much. And then now I got a little bit too much. Right? So now let's bring that up so you have a little better view. Maybe is that better for you? Right? So I'm going to do just again, circular type motion. So again, you wouldn't do this along delicate muscles. What you're going to do is you're going to do this along muscles like the erector spinae maybe, or that sort of thing. Larger, more superficial muscles where you might use that, right? It's not as good a palpatory ability. However, sometimes on the old Cro-Magnons, people that come into your clinic that are just tight like rocks, right? Sometimes those ones can work better. Some people like a little heavier pressure, so you can use that. So again, you know, you adapt your massage. We're still all trying to do the same thing, break down cross bridges, so we're just using a different tool. So it's fine. You adapt for whatever you need for that particular client. Having said that, one thing I should mention is when you have those clients that come in, when we're doing massage on someone, we don't want them to be overly tight. Because if they are too tight when we first start and we apply pressure in, that stretches a specialized structure inside of the muscle called a muscle spindle, and it actually causes the muscle to contract back. And that's, in most cases, the last thing we want to have happen. So what we're going to do is we're going to simply do take that tension out of there. So if there's too much tension in the muscle at the start, put a pillow underneath their chest or something like that when we're dealing with the back to elevate it up, and that's going to passively take the tension off of the back muscles and allow you to get in and get a much better result. And you will find, Here's a good example for you to do is do it on someone who's really tight, and then do it afterwards by elevating them up and taking the tension out of it, and see the difference in what the result is that you get when you're doing your techniques. All right, so that's friction.